This is Richie Venton from the Scottish Socialist Party, extending 100% solidarity to your struggle for pay justice and against the crime of poverty pay that blights those who care most for others in society. I'd much rather be speaking at an open air rally. I'm not exactly fond of this talking to a screen, but the reasons that the rally's not happening today is a reminder of the vital importance of healthcare workers in looking after the rest of society. But it's also a reminder of the fact that frontline staff are completely overworked, underpaid and undervalued, and therefore your arguments and your case for a big pay increase are more than justified. Now it's up to you to decide exactly what demands you want to make. Many are demanding a 15% pay rise, and I think that's entirely justified with the way in which the cost of living rockets. Whether it's that or the unifying demand which the Scottish TUC put out back during the height of the lockdown for a £2 an hour increase for all frontline workers, something I think should be turned from a phrase into a fight, from a nice idea into a campaign which could unify working people, including other frontline workers like the retail staff I've been elected to represent on a Scottish level on our union's executive. So whichever the detail, workers need a pay rise. There needs to be investment in health and care amongst other services. We saw the crimes during the earlier part of the pandemic in particular, where decades of refusal to invest in equipment or staffing levels led to the hospitals facing the prospect being overrun, which in turn, as we now know from recent reports, led to at least 1,200 elderly people being transferred out of hospital wards into care homes without being tested for the virus, leading to one of the reasons for the carnage in the care homes, which have cruelly blighted elderly people in our society. We can't have any more of that. We need a completely different future, a different normal, not a continuation of the same horrific exploitation and deprivation. We need to invest in equipment. We need to invest in the care of staff. We need to invest in their wages and staffing levels. We need to invest in staff having shorter hours without losing money. We need more staff to cover that. And of course, we also need something dear to my heart. We need to combat the crazy and cruel system where if you're sick, you can't afford to be sick, which has an effect on healthcare workers and right across society. Some of you will know that I'm currently in the situation of fighting for reinstatement to my job because I was sacked for daring to stand up against my own workforce that elected me, being blighted with the prospect of having to, in some cases, live on £95 a week statutory sick pay. But that's bigger than just the situation I face. I'm determined to help to spearhead a struggle for decent pay across the board, but also decent sick pay. I think every worker should enjoy at least their average wage, their full 100% average wage if they're forced to be off sick, so that they can care for themselves and recover instead of potentially damaging their own health and that of other people, highlighted of course particularly by this virus. So thank you for your efforts. I applaud those who have organised the tremendous campaign that so-called ordinary, in fact extraordinary healthcare workers have conducted. More power to you. I hope you win. We'll help in any way we can, and the Scottish Socialist Party stands on the side of working people, for people, not profit, for the health of workers, not the wealth of the rich. Thanks very much.